And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. So antibacterial soap, a good thing, a bad thing?
I mean, I think it's kind of a neutral thing. I think we have to understand that we're never, ever going to get rid of bacteria, fungus, viruses, parasites in our community. We have to learn how to live with these organisms. The organisms kind of feed off of us. If we do one thing, they do another to counteract what we did. So we just can't escape that. And I think if you want to use a bacterial soap, as long as it's approved and it's safe, I don't think there's anything wrong with it. But you shouldn't think that you're cleaner than the other person who's not using the antibacterial soap. Certainly it's marketing 101. They're trying to get you to buy the soap. So, you know, these sorts of things are common, and it's good that they're doing some research studies to make sure that it is safe, because you're right, there's all sorts of chemicals in the environment, in our food, the air that we breathe. The combination of all these things and the interaction with our genetics could potentially cause problems. So as of right now, I think if you want to use it, no problem, but continue to look for advisement in the future if it does prove that this is a connection with the soap.
If you want to be all natural, if you will, what are the best soaps to use?
To be honest with you, I really don't know. I mean, I don't know that that's actually been studied and researched for a physician to
We could do a study.
Absolutely.
Everybody else does.
I just need a grant. But I don't think that's actually been proven. I think it's really up to the patient. As you know, a lot of soaps have a lot of scents in them, and the chemicals used to scent the soap could cause skin reactions and all sorts of reactions. So you have to be careful. Obviously, Ivory has been around for a long time. We used that back in the day. That seems to be a pretty straightforward, clean soap.
And it's still around.
It's still around, but sometimes it can be very drying. You know, a lot of people who wash with Ivory complain about very dry, flaky skin. So for some people with sensitive skin, that might not be the soap for them. So if you've ever been to the supermarket recently, it's tons of soaps that
They've got a whole aisle.
Yeah, it can be difficult. You need a science degree just to figure it out. So just pick one you like. Be sure you don't have any interactions with it.
All right, on to some of our viewers' medical questions. This person wants to know, what is diastolic heart failure and what's the treatment for it?
It's a term to describe a particular type of heart failure. We have two types. One is systolic. One is diastolic. Diastolic means that the ejection fraction of the heart is preserved, but the heart still does not function very well. It is stiff, and it cannot move the blood the way it needs to move, and so it can present problems with what we call heart failure, shortness of breath, swelling, increased problems with not being able to walk when you exercise. So it is a specific type of heart failure. A lot of people have systolic, where the heart just doesn't beat at the efficiency it should. The ejection fraction is typically less than what we call 40%. That's something that can be picked up on an ultrasound of the heart, which if anyone is admitted to the hospital with heart failure, they're going to get an ultrasound, and we can make that distinction.
All right, we've got lots of questions. We'll get to those when we come back.
Right.
Don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your questions. This person says when he was 12, he had a really irritating case of tonsil stones. No matter what he did, he couldn't get them out, and he was starting to get a little desperate, so he used a vacuum cleaner. What exactly are tonsil stones?
Well, I think it's kind of a misnomer. I don't think they're stones at all. My understanding is that it's basically just old food debris. They're in the tonsils. The tonsils have creps, or little cavities, and when you eat and swallow, flakes of it actually break off into the creps, and basically it stays there, and it just builds and builds over time and can harden. And when you look in the back of your throat, you see these little white specks, and I guess some people would say it looks like a stone, but really it's just old food debris, and sometimes it can cause really bad breath and can sometimes get infected, a lot of sore throat, fever. A lot of times the tonsils can be removed if that is a big issue for you. So a lot of times it's not stones, just old food debris, unfortunately.
So don't use a vacuum cleaner?
Absolutely do not use a vacuum cleaner. We do not endorse that. Get to a healthcare professional of your choice to get a proper examination and to have them removed if they feel like it's necessary.
Okay, another question. What's the best way to calm down if you're having an anxiety attack?
Well, that's different for a lot of people. Certainly try to remove yourself from that situation. Sometimes it's very difficult because it can be a job, it can be your spouse, but certainly try to remove yourself from that situation. Certainly meditation, going to your religious leader, going to sleep, Certainly there's some other ways that are not necessarily endorsed. Drinking, smoking, that sort of thing is not good. Certainly try and get to your healthcare professional, maybe get on some appropriate medication such as Zoloft or Paxil. Maybe get to a therapist to kind of talk out and see what's going on. Develop some coping strategies to figure out how you can deal with those stressful and anxious producing events.
Okay, some other questions. 46-year-old female, are there any over-the-counter medications for insomnia?
I think a lot of people reach for Benadryl or Tylenol PM, which I think if you're young, you don't have a lot of medical problems, not a terrible idea, but certainly as you get older, Benadryl is not one of those medicines we really like, so it's not too many. Melatonin is a supplement that can be tried. It's a softer product, but a lot of times people want something strong with some strength to kind of knock them out. So melatonin is not really that strong type of medicine, but it works for some people. But other than that, not too many medicines over the counter for sleep. Certainly get to your healthcare professional. We have a host of prescription medicines for insomnia.
Okay. 22-year-old female, she's 31 weeks pregnant. Is it normal to have white discharge? It's her second pregnancy. She didn't have any discharge with her first.
I think it's okay. Certainly if it turns bloody and there's pain, there's fever, then that's a high concern. Certainly get with your obstetrician to get an examination. But I think if there's any concern, there's anything different, it's always best to check with your obstetrician, get an updated exam, because it could be something, but that's difficult to say obviously on TV.
Let me just say, 31 weeks pregnant in this heat, bless your heart.
Yes, absolutely.
Thank you, Dr. Levine.
My
We
pleasure.
appreciate it. And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, fax us 892-7305, email us at laf@kfdm.com, or post those questions every Monday on our KFDM News Facebook page.